Welcome, everyone. We are so glad you're here. Thank you for taking time to attend the training today, especially after a long school day. So we really appreciate you being here. The training today is 10 things school nurses and health office staff need to know about why we immunize. We appreciate you being here, and we are thrilled to see so many people joining us. On our registration list, we had many people register from all across Arizona. All 15 counties in Arizona are represented today, so thank you for that. Surprising me on the registration list, I saw a lot of people registered from La Paz, Coconino, and Yuma counties. So thank you to our rural nurses for showing up today, as well as our urban nurses, lots of Maricopa and Pima County nurses here today. So great. Thank you to TAPI and Central Arizona Area Health Education Center for making this event possible. We do offer CEUs for this training, but you must attend at least 90% of the live training to receive the CEUs. As you all know, if you're a registered nurse, they are very strict with those CEU requirements. So you must attend for 90% or more of the live training. Okay, then next slide. Just some reminders about today. Please place your microphone or phone on mute unless you are speaking. You can use the chat box for any questions. We do encourage you to use the chat box, ask your questions. We will try to answer them today. And we do have some TAPI staff monitoring the chat, so you may get your question answered that way today also. All of the handouts, video recording, all kinds of different things will be available on our website. So don't feel like you need to write anything down or try to capture any links. Those will all be available to you. If you are watching this training with a coworker, please put both of your names in the chat so we can give you both credit for attending today. Like I said, those CEUs, they are very strict on how we can administer them. So we want to make sure you get credit for being here today. Just to note, the presenters today have no financial interest or relationship with the commercial supporters of this educational activity. And so let me go ahead and introduce those presenters. We have Nadine Miller from Mesa Public Schools. She is also the president of School Nurses Association of Arizona. If you have not joined that, I do recommend you reach out to Nadine to join it. It's a great organization with a lot of great educational opportunities and more. We also have Tiffany Ellsworth. She is a school nurse at an elementary school in Mesa Public Schools. So we are so happy that they are here. If you both want to say hi for just a minute, feel free to do that.
Hi, everybody. Welcome.
Hi, welcome to you too. And thanks for welcoming us as well. I appreciate it.
Great. Okay, so let's get started. This is the training, and Tiffany, I believe you're going to kick us off first.
So we start off why we immunize. Why do children need immunizations, especially before they start school? So the objectives of this training are to discuss 10 science-centered evidence-based concepts about why parents should vaccinate their children, answer common questions and address the misconceptions by distinguishing facts from myths, provide participants with credible vaccine online resources for parents and colleagues. And the goal is that social workers, teachers, health educators, community outreach specialists, vaccine coordinators, medical assistants, and parents become knowledgeable on vaccine benefits, and this will drive parents to make more informed decisions on their intent to vaccinate their children. We will have some quizzes throughout this presentation, so you can use the chat box to be able to do those answers. So we are going to play a quick video, and we're going to talk about some of the things that we've learned through vaccines or vaccinations. So the video is going to go first.
I want to tell you about a time in American history so that I want to tell you about a
time in American history so that
it never repeats
So
itself.
it never repeats itself. It was a harrowing time.
a heart-wrenching time. I could hear my mother warn me, Seal, don't go out and play.
My family was ravaged.
Thousands and thousands died.
I was scared.
So scared.
And then one day,
And then one day, there was hope.
Before vaccines, there were few ways to help protect against deadly illnesses. Diseases like measles,
Meningitis,
diphtheria,
Hib,
whooping cough,
or polio, which killed my grandma's youngest son. Without vaccines, these threats can reemerge.
I'm here.
I'm here.
I'm here to tell my children to help protect their children.
Get your kids vaccinated and keep them on schedule.
I never want my grandchildren to see what I saw.
So the real dilemma that we have to face today, because the effectiveness of the vaccines over the last 50 to 75 years, that people have forgotten about the diseases that those vaccines were developed to fight. This is a phenomenon called vaccine amnesia or public health amnesia, where a public health initiative such as vaccination becomes so successful that people forget how bad it once was. And we can see things like measles cases starting to pop up more and more across the country. So we're going to go through the 10 reasons, and reason number 1 is kids are at risk for disease. So this map shows exactly what we were talking about with that public health amnesia. Measles was thought to be eradicated in 2000, but in 2014, new cases started popping up in unvaccinated communities. Still, 5 years later, we see that in 2019, all of the states in dark blue reported at least one case of measles. So if you really look at the count of the United States, there were at least 28 states that experienced at least one measles case. That is more than half from a disease that we believe to be eradicated. So the problem persists. These outbreaks are a direct effect of lower rates of immunization, and this shows that even when we haven't seen a single case of the disease in 14 years, that does not mean it has actually gone away. Continued immunization is the only way to prevent these diseases long term. Epidemiological trends are actually showing that right now, pertussis or whooping cough is beginning to recirculate. So the next slide. So ADHS requires every school to report once a year on the coverage levels of kids enrolled in schools. This information is made available to the public and parents can be informed about the coverage levels. Our schools used to be at least 95% covered, but over the last 5 to 6 years, the level of protection has begun to drop as the number of vaccine exemptions have begun to increase. Some schools have 40% coverage. Arizona has been identified as a hotspot because of low coverage levels. Next slide. So vaccine preventable diseases still exist. This data shows that the diseases still exist and are circulating. However, I could argue that if you've never experienced some of these diseases, you can fall into the trap of believing that these diseases no longer exist or that they will probably never touch you personally. This next video can be hard to watch, but we're going to play it all the way through for the full 2 minutes because it's important to really take in the impact of what this is.
Take it back there, honey. Come on. Almost there. There we go. Oh my. It's okay. It's okay. Yeah. It's okay. Here.
So outbreaks are, so we're going to go ahead to the next slide, but that's a rough video to watch, an example of whooping cough in such a baby so young. So the outbreaks are preventable when parents make the decision to vaccinate. So the way we have traditionally prevented outbreaks was to keep 95% of the population immunized against these diseases. If 95% of the people have immunity, the disease cannot spread through the community. It is also important that our youngest kids are immunized before entering school to protect the community around them. It is referred to as herd immunity, also called community immunity. We are attempting to keep our communities healthy, and the best way to do that is to vaccinate. I think it is easiest to think about community immunity in terms of a fence. So think about those of us who've been immunized as the planks in a sort of fence, and together, if enough of us are immunized surrounding one person who is not immunized because they are too young or medically fragile and can't be immunized, they are protected by the fence. When a disease comes up, it will hit the fence, and those immunized people will not get sick or be able to spread that disease, which protects the under-immunized. Outbreaks happen when there are too many holes in the fence, and a disease just floats right through. Once it infects an unimmunized person, it puts all the other unimmunized people at risk. So next slide. So we know that vaccines do work. We want to make sure that you have the hard evidence that vaccines do work. Once we have a vaccine against a disease, we have been able to eradicate, eliminate, or decrease the numbers of cases to almost 0% after the vaccine has been introduced. Vaccines are researched, monitored, followed in the community, tested, and updated. The vaccines we use today are not the same ones that were originally developed. And once a vaccine is approved for use, it is constantly tested and researched for safety and efficiency. These diseases go away because vaccines do work. So if you look at the screen, you can see that smallpox was eradicated in 1980 and it was decreased by 100%. Diphtheria, the last outbreak, was in the 1970s and is decreased by 99.9%. Polio was eliminated in 1979, so it decreased by 100%. So vaccines do work, especially in these childhood diseases that if they are fully immunized, then the children don't have to worry about getting sick and potentially dying from the diseases if we do get vaccinated. So next slide. So vaccines save an estimated 42,000 lives each year in the US alone. So, which is 3 times more than seatbelts and child restraints combined. So think about that for a minute. Choosing not to vaccinate your child is like putting them in a car with no seatbelt or child restraint. Most of the time, you're probably fine because statistically, you're not likely to get into a car accident. Maybe you're only driving 2 miles, but it only takes a single incident for a seatbelt or child restraint to be worthwhile in saving your child's life. It only takes a single exposure to a disease you can't see for a child to become ill with one of these diseases. And the long-term effects on their health can be very serious, even if they're able to survive. Next slide. So vaccines offer protection to us, but sometimes in different ways than what you may think about. So vaccines protect us from getting the actual disease, but newborns who are too young to get vaccinated are protected by their mother's vaccines. This is the first protection, but does begin to wear off around 2 months of age, and this is why there is a scheduled vaccination. The scheduled vaccination started out when the babies are 2 months old to continue this protection. Some people cannot get vaccines, they're too sick or they have allergies. These people are protected by those around them getting vaccinated. Just like in our fence analogy a few slides ago, and just as a side note, I think that you should know that only approximately 1 in a million children have true allergic reactions to a vaccine. Sometimes people get swelling or a rash or start to feel sick and think that's an allergic reaction. But a true allergic reaction is severe and incredibly rare. The CDC has researched the best time to give vaccines to offer the maximum benefits, so we should follow the recommendations on the schedule. And so getting shots offer that protection for the children. So Nadine is going to continue with the rest of the 10 reasons. I'll turn the time over to Nadine.
Thanks, Tiffany. Number 6, why vaccine antibodies act as personal ninjas to protect from actual disease. After someone does get the actual disease, it can take several months to years for their immune system to fully recover, leaving them very vulnerable to other diseases or illnesses. So it's always better to get the vaccine to protect them. The vaccine tells your body that it needs to equip itself against this disease before you have ever been exposed to it. And your body will respond and create a bunch of antibodies that will be like little ninjas trying to fight off the exposure. Many years ago, when vaccines were developed, they had a lot more antigens than in them to protect us against the disease. Now the vaccines that have been refined and updated, they reduce the amount of antigens needed to protect against this disease. All of that research of safety and efficiency has made it possible for vaccine developers to make sure that they are getting better and better all the time. So we have a trivia question. Laura, do you want me to do that or?
I can do it.
Okay.
So please put your answer in the chat for the chance to win a prize. Which vaccine is recommended during pregnancy? Is it A, pertussis or Tdap, B, flu, C, COVID vaccine? Option D is B and C, flu and COVID vaccine, or E, all of the above. So we'll give you guys a few seconds to go ahead and put your answer in the chat. If you are a prize winner, Denise will be contacting you. So watch the chat for a private message from her.
We have lots of smart people out there.
Okay, we'll give you a few more seconds if you want to put your answer in the chat. Lots of responses. I love to see everyone giving their response. Okay, so Nadine, do you want to answer this for us?
So the answer obviously is E, all of the above. I know that sometimes when our pregnant moms are in the doctor's office, they talk a lot about the Tdap or the pertussis, but flu, COVID are also very important to protect our infants, especially during those critical times when children are being birthed into the time of year where we have high flu or COVID issues. So all of the above. All right, number 7, babies get their first vaccine from mom. There are new recommendations focused on pregnant mothers that during every pregnancy, the mother gets a flu, pertussis, or COVID vaccine to protect her and her baby. It's important to talk to your OBGYN or have your parents at your schools talk to their doctors about the importance of when to get these vaccines. Many people have all members of the household get their vaccines to increase the protection for the newborn. Because these vaccines are given in pregnancy are the baby's only line of defense until they get started with their own vaccines at 2 months. We will talk about COVID in a few minutes. It's really important that you really consider having everyone around. Just because mom is the one seeing the doctor, not always does everybody remember that dad and grandparents and aunts and uncles and cousins and people around this child that are going to help take care of them or babysitters really need to have at least their tetanus boosters, but all 3 are very important for them to get. All right, I think we have, one more. Fight the flu. Obviously, it's an important thing, particularly right now. I'm guessing many of you are seeing a lot of illness at the schools. So here's your reminder to get your defense against the flu and get your flu shot. Those precautions that we talked about with COVID will also help stop the reduce of the spread of the flu. But without the vaccine, you can get a lot more sick if you are infected. And finally, if you do get the flu or believe you have flu-like symptoms, talk to your doctor and be tested for flu or COVID and possibly get the antiviral therapy that is available. Sometimes you hear people say that the flu shot makes me sick every time I get it. However, it is important to understand that the symptoms that you might experience after getting a vaccine are actually a good thing. A low-grade fever, body aches, or even fatigue are all signs that your body has accepted the vaccine and is doing what it's supposed to do, developing immunity. All right, trivia question.
Okay, so next question, can someone get a flu vaccine and a COVID vaccine in the same visit? A is yes, B is no, and C is not sure. Give you a few seconds to type in your answer. Okay, I think everybody is in agreement that A is correct. Yes, it is perfectly safe to get a flu and COVID vaccine in the same visit.
Okay, tip number 8, doctors and science support vaccinations. These organizations also support immunizations as a strategy to keep kids healthy. You need to trust your healthcare provider. Their education, knowledge, and experience is what you can rely on if you have questions. They are also great places to send parents if you get stuck on a question or if they have other questions about vaccines. Tip number 9, off to school, up to date on shots. It is very important that children be up to date on their shots because as they enter the classroom, they have a close contact with many other children where disease can spread rapidly. You don't want a sick child. You don't want your sick child or have them bring home a preventable disease that may be exposed to a younger sibling or an older adult that perhaps is under immunized. Each state has their own requirements in terms of school entry and vaccines. Try to become familiar with the guidelines for our state. The CDC website is also good information for all 50 states if you are unsure about specific requirements. Remember, sometimes your county has different requirements also. And also, a lot of families come to us from other states. They have different requirements. So make sure that they are being reminded that because they're now in Arizona, it's not because their doctor didn't do what they had to, but they do have to get the additional vaccines because they are now in Arizona. Okay, number 10, kids still need protection as they grow. We talk a lot about the baby shots, but the same recommendations for vaccines continue throughout their lives, and ours too. We recommend following the CDC schedule for immunization. The schedules are updated with new and improved vaccines as they come out. You can go to the CDC website to review these recommendations for yourself. They even have printable vaccine schedules that are easy to read for your reference. Remember, all of our kiddos at 11 need to have those updated shots. And we also should get our updated booster shots as they're recommended to us. All right, this is a great video that talks about why vaccines work. Although that's a little bit long, it's about 7 minutes, hang in there. It is a great foundation for understanding why vaccines work. Think about your questions while we watch this video, and then we will go through some common questions that you might have.
Aren't you glad you don't have scurvy? In 1747, in the first medical trial ever performed, Scottish physician James Lind found out that eating citrus fruits could cure scurvy. Now, today we know this works because citrus contains high levels of vitamin C. In fact, ascorbic acid, a common name for vitamin C, comes from the Latin for not scurvy. By issuing rations of lemon juice to sailors, the British Navy was able to pretty much eliminate the disease until the late 1800s, when polar explorers suddenly began to see scurvy again. The copper pots holding their lime juice had destroyed the vitamin C, but they were pretty confused. So despite James Lind's experiments 150 years before, citrus fruits became the enemy. And when Robert Falcon Scott set out to reach the South Pole in 1911, he carried the finest in canned meat products, biscuits, chocolate, tea, and zero vitamin C. A Norwegian team beat them to the pole by 5 weeks, and during their sad journey home, Scott and his team perished in a blizzard, sick and weak from what was probably scurvy. It had been so long since anyone had seen this disease, the British had forgotten how to prevent it. When we create such effective solutions, we can forget how serious the problems were. Thankfully, people today don't die of scurvy or polio. Since the introduction of Jonas Salk's polio vaccine in 1955, the disease has been nearly eradicated from the earth.
The thing to remember is that this is a continuous process.
Compare the 358 infections reported in 2014 to the 1940s, when 500,000 people per year were paralyzed or died from polio infections. Vaccines work. Our immune system is on constant alert against germy baddies, with millions of white blood cells each on the lookout for specific infections. When an immune cell meets its target, it replicates itself, and this clone army sends a barrage of protein weapons called antibodies to label the trash for cleanup. And after the infection is gone, so-called memory cells stick around, ready to mount a fast attack in case this germ shows up again. This is how we develop immunity, and it works pretty well, since we're all still alive. But even with all that, some super bad germs can take us out before our immune sentries have had time to call up their clone army. This is especially true for young children. Their immune systems are fresh out of basic training. Thankfully, we have vaccines, which are made of tiny pieces or weakened versions of viruses or bacteria. They let our immune system see what the bad guys look like and recruit those all-important memory cells before we ever have to actually see the real enemy. Thanks to vaccines, the US was able to eliminate measles in the year 2000. But in recent years, as more and more parents are refusing to vaccinate their children or are vaccinating them later than what doctors recommend, it's back. In most states, more than 90% of children are vaccinated, but that's not enough to keep a disease like measles at bay. In our episode about Ebola, we talked about a number called R0, the basic reproduction number for a disease, or the number of people infected by one person in a susceptible population. For Ebola, that number is low, but for measles, each sick person will infect up to 18 others. Well, luckily, vaccines can change that. The fraction of people who are vaccinated or immune can lower the reproduction number below 1, which means the disease is disappearing. 90% of unprotected people who come in contact with somebody who has measles, even just breathing the same air, will become infected. To control a super contagious virus like that, the vaccination rate has to be 95% or above. And right now the US is lagging behind, and measles is making a comeback. The Guardian put together a simulation of just how this so-called herd immunity works. When enough of a population is vaccinated, even if it's not 100%, the herd can protect the unprotected. With vaccine refusal on the rise, our herd immunity is breaking down. Preventable diseases like measles and whooping cough have become our scurvy. Most of us don't know anyone with polio, and measles. It's not that bad, right? Well, yes, it is that bad. Before the age of vaccines, millions of people were killed by diseases that today are just bad memories. Vaccines have let us develop a sort of generational amnesia. Today we expect our children to grow up healthy, and we're lucky that we don't appreciate just how dangerous these diseases are. Like science writer Seth Mnookin says, vaccines are victims of their own success. Because of stories like Andrew Wakefield's discredited study wrongly linking vaccines and autism, and the news media's obsession with pictures of crying, terrified children being poked with needles, people are nervous about vaccines. This anxiety isn't new, though. When Edward Jenner in 1798 saw that milkmaids didn't catch smallpox, he realized that because they'd been exposed to the similar cowpox disease, they were immune. And based on this, he developed an early smallpox vaccine by inoculating humans with the cow virus. In fact, the word vaccine itself has bovine origins. Still, as far back as 1802, critics were claiming that the smallpox inoculation would turn you into a cow. Vaccines don't come without risk. Nothing does. But on average, fewer than 1 in a million people will experience a dangerous reaction to common vaccines. And car accidents, playing outside, even walking will injure more children. Vaccines are asking us to do something altruistic, to make a choice to protect not only ourselves and our children, but also those around us. Author Eula Biss says that vaccines are one of the most empathetic things that we can do. A system that's based on people voluntarily using their bodies to protect other vulnerable people. And that's something I hope we don't forget. Now, I'm a doctor, but I'm not that kind of doctor. It's natural to have questions about vaccines, and you should have a conversation with your medical professional. They want the best for you and yours. I will give you one prescription though, and that's to subscribe so you can get a full dose of science every week. And if you
Okay, so if you have any questions, please put them in the chat. I'm going to talk for just a few minutes about COVID vaccines and give you kind of the updated information. I work with TAPI, so this is what we talk about all the time is vaccines. So everything we just learned today about how vaccines work also apply to COVID vaccines, including all the safety, monitoring, and approvals. Full safety trials were done on each vaccine and ongoing monitoring continues. Children were not among the first to get the vaccine because clinical trials did not include children. However, as the vaccine proved to be safe in adults, additional trials have included children. So now children 6 months and older can receive their COVID vaccine. It is safe for children to get their usual vaccines along with their COVID vaccine. Vaccinated kids protect other kids in the classroom and their families and friends and neighbors. The good news is children who are vaccinated will not have to quarantine for 2 weeks after exposure to COVID-19 and will be able to stay in school and activities. Now, if you are a school nurse or health office staff, I'm sure you're all very familiar with the quarantining guidelines and things you've had to do over the past few years. I have several children in school, and I have received so many letters from my school nurses telling me they were exposed to COVID and what the quarantining protocols were. So I'm sure you're all very familiar with that. And the good news is once my kids were able to get vaccinated, the guidelines said they are okay to stay in school as long as they're not having any of the symptoms. And what a relief it was, because at the very beginning, when my fifth grader was exposed to COVID and had to stay out of school for 10 days, he was bouncing off the walls. He was completely crazy, going crazy at school, never got COVID from that exposure. And that was disruptive to his school schedule and schoolwork and also our family and my work. And so I'm so grateful that I could get my kids vaccinated and protected from COVID. Just wanted to point out the little circle here. I hate updating this number every time we have one of these trainings, but since the beginning of COVID pandemic, among children, there have been 15.3 million cases of COVID. Those are reported cases, not just a home test that never gets reported, 15.3 million cases. And unfortunately, that has led to 1,633 deaths in children from COVID-19. So that number continues to climb. We do recommend that everyone get vaccinated against COVID-19. You may have heard of bivalent booster or the new booster, and you may have been wondering who needs to get that. Do I need to get that? So bivalent boosters are available for everyone ages 6 months and older. If you have completed your primary series it has to be after 2 months, then you can get boosted. These bivalent boosters were developed because the original COVID vaccines targeted the original COVID-19 strain. And as we all know, there have been many variants of COVID, making the COVID-19 vaccines less effective over time. So this new bivalent booster provides vaccine protection against both the original strain and also the new Omicron strain. Does anyone have any questions about COVID boosters or bivalent boosters? If you want to put them in the chat, we have a minute to answer those. Sometimes you don't know where to go get a COVID vaccine. So TAPI developed this COVID vaccine finder. It is fantastic. It is very easy to use. Denise is going to put the link in the chat for this. And what you do is you type in your address or the school address or wherever you are, and it will show you what COVID vaccines are available within a certain amount of distance. So you can set that to within 1 mile or 10 miles, 50 miles. It'll show you where you can get one of those COVID vaccines or boosters. It also sorts by original COVID vaccine and boosters, as well as ages. So I have used this many times since it was developed. So like when COVID vaccines were available for my age 5 to 11 children, I typed in our address and I was able to find the closest location that was offering that. So it's a great resource to use personally and also to recommend to any parents that are looking for that. We have these appointment cards that you are welcome to order from our website and pass out to anyone at the school. It's just a great resource to remind people to get their COVID vaccine and not to wait, because time to get vaccinated is right now. Let's see if there's any questions Denise has not answered. What was the effect of the fast?
Working on it.
You're working on it.
You can answer though. Yeah, you can answer.
No, it's fine. It's fine. The next part of our presentation, I'm very excited about. We have a special guest presenter, and this is her first time presenting to this training. So we are so thankful that she was available and willing to talk to us about the HPV vaccine. The best thing about the HPV vaccine, it is cancer prevention. When my kids turned 11 and they needed to get their 11-year-old shots, my son said, "Mom, what is this shot for? Why do I have to get this?" And I said, "Oh, this one prevents cancer." And he was like, "That's amazing." So Gail, I'm going to let you share your screen and your slides and talk to us about the HPV vaccine.
Okay, I got my chat. Okay, you guys, I have COVID. So thank goodness we're online today. And
she says she's feeling good, and we're thankful she's here.
Two really crummy days, but I'm telling you, I've had 5 Pfizers with the bivalent, and I know that that's why I feel pretty good. I need to see that. I also want to tell you before I begin, because now I've got to get my slides up over here on another screen, is that I was a school nurse in the Creighton district in the 90s. That led me to graduate school because I was seeing so many sick kids and I was the only healthcare provider for 30% of my population. And so I went on to graduate school. We started a school-based clinic in the Creighton district. We also went to a school, a church, and a homeless shelter called, project was called Breaking the Cycle, if any of you guys have been around for a while. So I want to thank each and every one of you. My school nursing job was the most challenging position I ever had. I had to use my brain more than in any other nursing job. So anyway, thank you for what you do. And I've got to get up here. I wasn't sure if I was going to change the slides or if you guys were, so hold on a sec.
And you should be able to share your screen. I gave you access to that. So.
All right. I think I'm ready to go. Okay, can you all see my screen now?
Yes. Yep.
Great. So my name is Gail Peterson-Hawk. I have a doctor of nursing practice in public and community public health. I'm a public health clinical nurse specialist. And I retired recently from an associate dean position in well, not recently, an associate dean position in California. I was also a professor in the RN to BSN program at ASU until 2013 and worked with TAPI. This is my 3rd decade, I believe, working with TAPI because vaccines, the importance of vaccines became so clear to me when I was a school nurse. Before I was a school nurse, I thought everybody got their kids vaccinated, but that's not the case, is it? So now I'm with the National Cervical Cancer Coalition and I co-lead our Arizona chapter. So today we're going to differentiate between school vaccine requirements and CDC vaccination recommendations, which both Tiffany and Nadine already talked about. Explore the status of adolescent vaccine coverage in Arizona, explore the burden of HPV-related diseases, and discover opportunities for school nurses and school health personnel to reduce the risk of HPV-related cancer. So what I say is that when we miss an opportunity for HPV vaccine, we create an opportunity for cancer. And I've been saying this since we got the vaccine in 2006, and I was working with TAPI to try to raise rates and raise understanding of efficacy and safety of this vaccine. Very important to me. So what I did want to do is pull down the 2021 Teen VaxView data from the CDC. This is HPV coverage in Arizona. This is from the National immunization survey that's done annually by the CDC. What I do want to bring up is it's a small sample size that the data is based on. You can see the sample sizes over here are pretty small. Males and females together only 179. And that's because the data here, there's a telephone survey, and then then they call the provider's offices to make sure that the reporting that the parents give and that the provider has on record are congruent. So they are small sizes, but we can compare Arizona then to all states when we look at this data. So I pulled the numbers for 13 to 15-year-olds, and this is for people that are up to date. And we look at males and females. It says 53.8%, 54%. This is a concern to me. Some of the data that we have individually through our state immunization information system shows a little bit lower coverage than that, but this is still nearly half the kids in our state, according to this national data that's verified. And then similar for females and males as well, 13, and this is from 2021. The data from 2022 has not been published yet. All right, so the burden of HPV related disease, and I thought it was really interesting when Tiffany was talking about the cases of the measles in 2019, 1,250. When we look at cervical cancer, these are the annual cases every year, 11,000, and this is a little bit low based on recent data, a little bit lower than recent data. But I love this image, and I wanted to show it in the presentation today because I think visual images are so important. But when you see these cervical cancer data reports, it does not include any of the cervical precancers, nor does it include cervical cancer stage 0. It only captures invasive cervical cancer, okay? So we don't see in the data when you hear that 11 to 12,000 or sometimes 14,000 cases of cervical cancer reported annually in the United States. It doesn't include those precancers. And then I also want to speak to the other cancers caused by HPV, and we see in the back of the throat or oral pharyngeal cancer. Now those numbers are now higher in men than invasive cervical cancers in women, or higher in males than invasive cervical cancer in females. It's something we really need to be aware of because there are no screening tools for that oral pharyngeal cancers. They're diagnosed once it's apparent and invasive. So, and then anus, vulva, penis, and vagina. There's also laryngeal papilloma too that comes from HPV that can impact an infant from going through the birth. I don't have any data on that for today. So 90% of HPV related cancer can be prevented with a vaccine. And I repeat that, 90%. Just like we were talking about the other vaccine preventable diseases. So with cervical cancer, this again is a reflection, 200,000 cases, but more, maybe 300,000 is the last data I saw, and 11,000 cervical cancer cases. This comes from the CDC. And unfortunately, there are 4,000 deaths annually still in the United States with women who are diagnosed with cervical cancer. So there's a huge burden of disease. So these diseases that are HPV related, they're transmitted through close contact, intimate contact, sexual contact, but also skin to skin contact. And we have to think about that. Not necessarily always oral sex or vaginal sex, but close skin to skin contact can transmit the disease. And so I wanted to look at who's ever had sexual intercourse. And I pulled this data from Arizona from the Youth Risk Behavior Survey that the CDC does. And this is from 2019. And so these are 9th grade students. So that's freshmen, right? Freshmen. And it looks as if 18%, and then the range was 15, the confidence interval 15 to 21 or 22%. And then more males than females reported that they were sexually active in the 9th grade. diseases that are related to intimate contact are still cloaked in embarrassment, and people don't really necessarily want to talk about their own experience as an adult. But it's important that we, as in school health, understand that we have the opportunity to protect. And as Macrina Leach says, and she said this to me over and over, she says, you know, when somebody asks me about HPV vaccine, I say, we give all vaccines before exposure to disease, all vaccines. And HPV is one of those vaccines. So this is the Teen Vax View from 2021. And I looked at at MMR and Meninge and Tdap here. And we have two age ranges. We have 13 to 17 and 13 to 15. And you can pull this data down if you want to fiddle with it on your own from the website. So when you look at the coverage estimates, look at these. We've got like, you know, really high coverage in the 90%. And the Healthy People 2030 wants 80% coverage in the HPV vaccine. That's the goal. So when you look at these coverage rates, and then you look at then we look at HPV coverage rates, when now you know that the burden of disease from HPV is greater than the burden of disease from other vaccine preventable diseases. And I don't see the chat box now with my screen share. So, I mean, I hope that my presentation today makes you aware that although we do see a decrease in cervical cancer since we've had HPV vaccine, that data came out from the American Cancer Society, we're still kind of we still need to protect, that's for sure. So I'll move on to my next slide. So Arizona school nurses and school health personnel do have an opportunity to prevent cancer in your students' futures. And again, this also depends on perspectives of your school districts and how you want to go about this protection, where you want to include information. But I think it was in 2014 or 2015 that ADHS and the Arizona Department of Education came together, and we have the school required vaccines, and then then they also include all the CDC recommended vaccines, which includes hepatitis A, HPV, and seasonal influenza. Now on the referral form that you pull down from ADHS, what we hear anecdotally from nurse practitioners and from providers, that if HPV vaccine is also highlighted when you send these letters out, that it's a gateway for the conversation with the provider, and also with the parents as well. It eases that conversation, that transition, and it normalizes. And that's what we want to do. We just want to normalize HPV vaccine as standard of care. You know, it's just one of your teen vaccines. You can start now, you know, as early as 9 with it. And there's a recommendation on the CDC schedule, and as well as American Academy of Pediatrics and American Cancer Society recommend that we start it at age 9. So in this 5th grade, when I pulled the enrollment data from the Arizona Department of Education, 5th grade enrollment was more than 80,000 students across our state. So those are 80,000 students that when referrals are happening, that there's an opportunity to alert parents that, you know, maybe they didn't provide because they're not required for school. They may not have provided those records to you on hepatitis A or HPV for K through 12, but it's an opportunity to refer. And and we know you don't report on these either for your IDRs, but for the 6th grade, but it would be a perfect time, in my opinion, from the National Cervical Cancer Coalition to alert parents that this vaccine is due. So this is me in January 1982. This was 6 months before I got my cervical cancer diagnosis. And I was one of the lucky ones. I had stage 0. I had 2 kids already. And we know that even the precancers can impact the ability for the cervix to maintain integrity throughout a pregnancy. So again, I'm going to say, when we miss an opportunity for HPV vaccine, we create an opportunity for cancer. And I don't want, you know, like I said, I was one of the lucky ones, but I work with a lot of women in the National Cervical Cancer Coalition who are not so lucky and have had a really long, hard journey with their cervical cancer experience. And I still, you know, I have biopsies every 6 months until I was in my 40s. And I'm telling you, that's not very much fun at all. And I did have some treatment with TCA, I think in my 40s as well, because some of the dysplasias did come back. So do we have time for this 3 minutes or not?
Yes, go ahead.
Okay, so what I really wanted to tell you was that suffering can be prevented sometimes. And I mean, if we can prevent suffering in another, I mean, that's what vaccines are all about. And I want you, and I know that all of you have been involved as school health personnel, school nurses in the prevention of disease, but I'd like you to hear the voices of some of my colleagues who talk about their experience with cervical cancer. And let me know if you can hear this.
What I wish my doctor knew.
What I wish my doctor
What I wish my doctor knew.
What I wish my doctor
What
knew.
I wish my doctor knew. Well, there are two experts in the room. The physician is the expert on the science, and the patient is the expert on their body and medical history.
See my humanity and not my illness. Be mindful of what and how you deliver a diagnosis. Your words can make or break your patient.
I wish my doctor knew to test me for HPV along with my Pap screening.
I wish my doctor knew that looks can be deceiving. He presumed to know what was wrong with me, ignoring advice of both a neurologist and nephrologist because I was too healthy to be in the hospital. His exact words spoken as I was discharged as terminal stage 4 cancer raged internally.
What I wish my doctor knew was that my cervix was an important part of my body, that I grieved having it cut away. It felt like a piece of me was missing each time they took more. Even though I knew that they had to, and I am thankful that my life was saved, there was and still is real grief.
I wish that my doctor had asked if I wanted more children before making a judgment call in the middle of surgery to remove so much of my cervix that it isn't possible for me to have babies anymore. And I wish she knew how to treat a scared patient like a person and not the illness.
I wish my doctor knew that I could get caught up in my mind stories, scared that I wouldn't be here. That cancer affects the mind and not just the physical location. That cancer is never far from one's thoughts, even several years later.
I wish my oncologist knew how much it meant to me to wake up from my operation to a handwritten note that told me that he had taken all the cancer out.
I need support from other survivors. Hook me up with support systems. I have a lot of emotion going on that I believe other survivors can help me with.
I wish he would have asked me to bring someone with me when I came in for my results and was diagnosed with cervical cancer, so I wouldn't be alone. Give me hope. I don't necessarily need all of the details of my treatment. I just need hope.
What I wish my doctor knew. What I wish my doctor knew.
What I wish my doctor knew.
What I wish my doctor knew.
What I wish my doctor knew.
So just wanted to, I know these women, it always chokes me up to watch that because I know these women and some were there representing those that they had lost. And let's make a world where people don't have to go through this and we're all here in this together and can work together to prevent HPV related cancers. We don't have a ton of information or men coming forward to talk, but we in Arizona are happy to reach out. We will come to your schools. We'll talk to your PTAs. You know, we're here to help. And what I've experienced is that when I give a talk about HPV vaccine or cervical cancer screening, every time someone comes up to me in the hall and tells me about themselves or about a loved one, because there's still, again, there's that cloak of embarrassment to talking about this disease. But I'm always happy to share my story and those of my colleagues. Anyway, so what we want to say is thank you for having us today from the Arizona chapter. Chandra Hall was in that video. She was the first one to speak. That's me. And we have Post Schweiger, who some of you may know from her work with Tappy, and then Lindsay Dowling. So that's it. I just want to say a big thank you, and thank you for the time. Thank you, Laura.
Thank you so much. And, I really appreciated what you said about how the school nurse and health office staff can make such a big impact by simply highlighting that recommended vaccine, also the HPV vaccine. What a simple way to make a difference in your school every day. So thank you so much. And we were so happy to have you present today.
I'm trying to can you stop the share? I can't find the button now. Oh, there it is. I found it. Okay.
Okay. Great. Thank you. All right. So next we're going to talk about the immunization data report. What is the immunization data report?
So you take over there, Laura?
Yes, I'm so sorry. I just got a message from Zoom that something happened, but can you guys see my screen?
Yes, you're a little frozen, but I can see you and hear you. Cool. So I'm back up to Gail.
I think we lost Laura.
I think we lost.
Okay,
lost her
I'm
screen.
not sure. I'm not sure what happened. Can you hear me okay?
Yes.
Yes.
Okay.
And now the slide's back up again.
Perfect. Go ahead and take over.
Okay, so the immunization data report is the report that we submit to the ADHS every year. So each school has to submit that report, and it tracks the vaccine rates in our schools. And so they're able to gather all that data and see what kind of vaccination rates we have. So Laura wanted to talk a little bit about tips for completing the IDR. So I've been with an elementary school for several years, and I've tried different ways, and every year I've just kind of modified the way that I've done it to try to get it done sooner rather than later, so you're not stressing out toward November when it's due. So what I've started doing is, for sure, as soon as we get back to school, actually I start the year before. So at the end of the school year, I get letters out to those kids that are turning 11 years old over the summer, and I'm letting parents know, hey, your student is turning 11 over the summer. Please get them vaccinated with their 11-year-old shots and have them done and turned in before the first day of school, if at all possible. And then I start looking over everything as soon as we get back to school, and I start sending out those referrals, even sometimes before they're back in school. I put them in the mail for those parents. But as soon as those kids are back, they start going out to the parents and they get those referrals, especially the kids that are already 11 years old. And then any of the kids that are new that are coming in, that the parents are still trying to collect that data and get those immunization reports into the school. My goal every year is to get that immunization data report done before fall break. I know everybody's situation is different. I know that it can be harder in some areas. I'm in Maricopa County. In Mesa, we have a lot of resources for our kids to get those immunizations done. And I also have a supportive principal and administration that allows me to exclude kids after they've had sufficient referrals and the parents still have not taken them to go get those immunizations. I'm able to exclude those kids, and a lot of times that's the only thing that wakes the parents up and gets them to go get those shots in and gets those kids back into school. So I also recommend, as far as the ADHS has a module that is for the kids being exempted, that the parents want to exempt the kids, but watch the module. It's got a ton of information about each immunization and what it's for and the benefits of it. And for those that have issues with your administrators that don't want to support you in trying to get those kids the immunizations that they need, whether or not it's to exclude those kids from school, it's a state law that those kids have those immunizations. So if they're on campus and they're not fully immunized and they are due for those shots, then the law requires them to have those shots. So that's really where, you might have to push that administration just a little bit if you have to. And sometimes you may have to go to your, head up the chain. And if you have any questions or whatever, if anybody else has any more tips, they can definitely add those to the chat. Nadine, do you have any more tips?
No, the only thing I was going to say, Tiffany, is sometimes somebody's moved that's not the same school nurse or health office person that was there that sent the last one in. So if you have somebody in your district that is not that person, that goes back to whoever sent the report in the year before. So if that person has changed, please try to forward those so that the state can collect that data and have some good data to work with, and to help to support you with the things that you need. Because if you don't make your state goals of that, the state does send out a little nasty gram to your principal, which sometimes helps. So it does get them to do a few little things to help to support you if that's the case.
Correct. So
I'd love to hear if any of the people attending today have any tips for completing the IDR, anything to add to Tiffany's tips. We can all learn from each other, and sometimes there are different creative ways to do things that would be helpful. As you're thinking about that, we do have a trivia question. So who needs to complete an IDR? You can put your answer in the chat. A is licensed childcare providers, B, schools, C, preschools, like under age 5, and D is all of the above. So go ahead and type your answer in the chat box. We'll give you just a minute.
Laura, while they're typing that, there was a question about, there is a state law that says that parents can sign a personal exemption. That is true. Like Tiffany said, for us, we make our parents do the educational module that's on the ADHS website. And the reason we do that is, like anything else that you are exempting from, we want parents to have the information and have good knowledge of what they are exempting their children through. Like in many of the questions that we asked, in the tips and things, sometimes parents, especially if they're young parents, they don't understand what the disease even is. They haven't experienced it. They don't have any family members with that anymore that have had that. And so they don't think it's around or a problem anymore. So they just want to sign the paper and get their kid into class. And we understand that, but they still need to have informed consent. And it still is very important that we inform them and help them make a good decision on what they choose to do for their student. There is also a medical exemption that doctors can exempt.
So the law does not require that.
I'm sorry, Tina?
Yeah, I saw somebody ask a question, does the law require, or does Arizona require? Arizona does not require those modules.
No.
You would just...
It is a program that certain districts or schools can opt into and do that. Mesa has been doing it as a pilot program for many years now, and we have pretty much are convinced that is a good way for our parents to be informed and have informed consent. And honestly, we have not had many concerns or kickback from that, because I think parents realize that it's something that they need to make sure that they have good information on before they make that decision. Many of us that have been in schools for lots of years know that parents just wanted to sign the form and be done with it. Not that they necessarily even believed that they were wanting to exempt their kids. They just don't want to do it right now. And they would sign the paper and be done.
So
Nadine, I have a question on the modules on the ADHS website. I know Mesa does it, but how do you guys do it? Like, do you guys have like a tablet or a computer that the parents do there at school, or do they have to do it on their own at home? How does it work?
We've had it done both ways. What you do have to do is have a way to print the form or take a picture on your phone. So you want parents to understand that before they go in. But a lot of parents obviously have access. You can do it on your phone. It's a little more tricky because it doesn't always connect really well. But we have also offered him to come in. We have many schools that do online registration, and parents don't have access to that computer to do that. They can do it at the library. They can do it at our schools. They can do it at a friend's house. You can get on almost anywhere. But I think one of the things that Tiffany was saying is you know, if you're new to school nursing or you haven't seen some of those, they're good for you to watch too, and get that information and that background knowledge of what it is and what those diseases look like, and be able to talk a little bit more informed to that parent as you do that.
And you can also give them an idea of what they're going to be looking at when they look at the modules as well, and kind of guide them through if they have any questions. But I send a link to my parents if they ask about it. I just send it to them in an email, and I let them know if they don't have a printer to make sure they take a picture of it. Then they still have to come to the school and sign that form, even after I print it out. They have to sign it for it to be illegal, you know, to be good enough. So.
And they don't have to watch the whole video. They only have to watch the videos that they want to exempt their children from. So if you want to exempt your kid from everything, it might take a good 40, 45 minutes. If you want to exempt your kid from meningitis, it might take 10 or 15 minutes.
Yeah.
Okay, so the answer to the trivia question, most people got it. D, all of the above. So licensed childcare providers, schools, and preschools, they all need to complete the IDR. And then we have some kind of question and answers. I love that you guys are putting your questions in the chat and even unmuting. That is great. So feel free to do that. We have some questions we received before the training that I'm just going to read off and let Tiffany and Nadine answer them. So the first one is, how often do we need to complete the IDR?
And that's just once a year. Do in November.
Yes. That's an easy one. And we talked about the family education requirement to accompany the personal exemption forms. So is this a requirement?
It is. So it's not a state requirement, but thankfully at our schools, it is a requirement for the parents. It just, they can, schools can choose to opt into that, but they don't have to.
Okay. And we have another trivia question. Put your answer in the chat again. We are private messaging people that are winners today. The question is, I can't find a record in ACES for my student. This means that they are not vaccinated. Is this true, false, or are you not sure? Okay, everyone seems to know that this is false. Tell us why it's false. Nadine?
Sure. Students don't have to have a record in ACES. Maybe they've recently moved here from out of state. They wouldn't have a record in our state immunization record. Maybe their provider hasn't entered that immunization yet. If this is a student that maybe is a high school student, sometimes it wasn't required back then that they were all entered. Now pretty much all vaccines are supposed to be entered by their provider, but there were some years where unless you were getting vaccine for children from the state or had some other qualifying pieces of it, they didn't have to do it. It was strongly encouraged, but now pretty much everybody has to do it. So they should be in there if they have had records in the state somewhere. So you want to hunt them. You do have to hunt them sometimes a little bit harder than you would think. If a parent has, maybe the child has two names, maybe they didn't spell it right on the form that they sent to, they went to a county provider, then they went to a doctor's office, then they went to a fire department. They may have them entered all on all kind of charts. So if you see those, you may want to ask the county to go ahead and merge, or the state to go ahead and merge those records. But please look for multiple records, particularly if children have multiple names. Maybe parent put them under something else. Ask the parent, could you have put this under a different name? Or sometimes they'll put them under the parent's maiden name and not the child's name. You kind of have to be a little bit of a detective sometimes to be sure that you get all of their records if they are on different pieces. Always you can call over to ACES. They are always willing to help you to get that information. If you are not able to access that information, you also need to reach out to ACES and they will add you as a read only so that you can go in and look at those records and have access to that.
Okay, great answer.
There's a question on there about nurses having access only. Nope, I put all of my health staff on. Everybody has access. It is read-only access. And so we submit their information and send that in there, and anybody that's working in the health office can have access.
So I'm seeing a few questions in the chat. Do tribal clinics have to upload the vaccines to ACES? I do not have an answer to that. That is a really great question I've not heard before. I will check on that, and then Delene, I can email you if you want to put your email in the chat or private message me.
This is Felicia. We're over here on the Navajo Nation. Yes, they do have to.
Sounds good. Okay, so here's another question. I have many students who have their immunization records from out of state or out of the US. Some pediatricians do not want to enter these into ACES. So what's your recommended response to this? Tiffany or Nadine, who wants to answer this one?
There's really not anything you can do if they're opting to not do it. You can't make them. So, Nadine?
I mean, I have contacted the county and asked if they would help with those things, or whoever that provider is, to put them in as historical documents so that that child has a full record. We do know that kids don't keep, parents don't keep records like maybe our parents did, because of lots of reasons. They figure if it's online, they can access it. So I do try hard to ask our providers to sometimes help us out, that sometimes we know these kids are very transient and we want them to make sure they have something. I also have encouraged even our high school nurses to send some of those things or make that available to our high school students, particularly if they're going to go to college, because sometimes they don't have a record. So before they leave, some of the colleges and the dorms require certain immunizations. So sometimes it saves that kid a trip back. They don't think it's important when they're in high school, but all of a sudden about 6 months into it and they need it, now they're calling you or hunting it down or trying to find some things. So I'm trying to make sure that they can find that, or give them a copy of it so that they can have it in their records is important.
Okay, thank you. Next question. What do we do when our district is not following state law and allowing students to attend and to be registered when non-compliant, and they have been sent multiple referrals and phone calls? What do we do?
Well, that's a hard one too. Obviously, we want our schools to be healthy and safe and keep our kids immunized. I know as an administrator, I hear frequently from my superintendent that we need those little seats in the chairs so that we can be sure that we have attendance and we can meet those needs of our attendance issues. So they are very challenged sometimes, particularly at the beginning of the school year, to be sure that our numbers are accurate and what we're sending into the state really reflects what we have. But honestly, those administrators need to know that they're liable, that if there's an outbreak, if there's a problem and they are neglectful in that, there are courses of actions that are taken in an outbreak. Unfortunately, an outbreak would have to happen. But I do think sometimes it's about trying to make sure that our administrators understand it's not, we don't want kids in school. We want kids in school, but we want kids to be healthy and safe in school, and we want to protect maybe those more vulnerable kids that can't be immunized. I have had conversations with many administrators, and I have had conversations with many of my superintendents about why that's important. But the bottom line, it is a state law, it is required. And yes, do we want to work with them? Absolutely. We don't want to say on the first day, oh, hey, all you guys are out because you didn't get your shot records in. First of all, most of us can't get them in that fast. But the other problem is I want to show my due diligence that I have made contacts. I have given this parent resources. I have suggested places where they could go. I have done the things that I know we can do, because we know there's lots of reasons why parents don't get vaccines. And it's not always because they just don't want to do what we want them to. Sometimes there are lots of complicating factors to that. So reach out to those parents, try to work with them, try to find them resources, try to find them opportunities to be able to do that effectively and in a timely manner. But the bottom line is, it is a state law and you can suspend kids from school I kind of hate that word. I really hate it when we say we're suspending them. We're really just not allowing them to come because they're not compliant with the requirements of the school.
Okay, thank you. So now if anyone has any additional questions, any questions that parents ask you and you're not quite sure how to answer about vaccines, please type them in the chat. We can ask our expert nurses here today. Let's see. Maricopa County comes out to school events to immunize students that need it. Yes, that is great. And if you're not in Maricopa County, there are definitely many county health departments that are willing to do that also. So contact your county health department. How to address lots of false information and myths. Yep, we can talk about that for sure. Sometimes it's specific to an actual myth. I know that Denise has been answering questions throughout the whole training, but we do have a few different scenarios that come up that you may have heard, and we'll give you some different resources of how to answer them. So let's go to the next one. I'm not sure if Tiffany or Nadine, which one of you want to do this one?
I can do it. It's just a parent tells you that they worry newer vaccines are not safe and that they worry that pharmaceutical companies make vaccines without testing them before they are given to kids and adults, and what resources are available to them with their concerns. So did you have on the next slide, is there a video? So there's a lot of information and there's a lot of testing, obviously. So before a new vaccine is ever given to people, extensive lab testing is done that can take several years. Once testing on people begins, it can take several more years before clinical studies are complete and the vaccine is licensed. The FDA sets rules for the 3 phases of clinical trials to ensure the safety of the volunteers. Researchers test the vaccines with adults first, and then the FDA and CDC closely monitor the vaccine safety after the public begins using the vaccine. The purpose of the monitoring is to watch for adverse effects, any side effects, and monitoring a vaccine after it is licensed helps to ensure that possible risks associated with the vaccine are identified. So there's the view.
Safe and effective. How a new vaccine is developed. And vaccines
Laura, I think that a lot of people can't hear very well. The sound seems to be a little muted.
Oh, it does? Okay.
Maybe
we'll skip this one and we will put the link on our website if you want to watch it separately. Sorry, let's go to the next one. Okay. So here's your situation. Go ahead.
So mom receives a note from her preschool that her baby is behind on the required school doses. And you also notice that the baby needs a pneumococcal, but mom declines because she just wants to get the most important vaccines that are required and wants to wait on the optional vaccines. And so what are some of the things that we can say to educate parents about rules versus recommendations, or what's required versus the recommendations? So Nadine, did you want to say anything?
So the ACIP, which is the Advisory on Immunization Practices, they put out a lot of information, and we have lots of support groups from Academy of Pediatrics, nurses associations, family physicians. They all are experts on these and will talk about these things. I oftentimes, I do some vaccines with my fire department. That's another resource that many of you might have, is your fire departments do things. I know Phoenix Fire does, Mesa does. So there's some fire department groups that do that, and sometimes some additional ones at the beginning of the school year. But we have a lot of times that a parent comes in and says, I just want to get one, today I need 4 of them, but I just want to get one. I work with one of the county nurses a lot, and she tries really hard to explain that, you know, like we said in our tips, there's not a lot of the antigens that are in it are not concerning. We can give kids multiple shots. I will tell you, one of the worst things that happens, and we had one just yesterday because I did the little clinic last night. We had a dad that has brought this kid every month for one shot. This kid loses it walking it in the door. It is so hard on these kids to come back month after month after month to get one, when we could have given this kid a whole bunch of them and they could have been done and in school and moving on. But you know, you have to walk through the concern for this parent and what their concerns are. We you know, they are very available. I have noticed those since COVID, more parents are questioning vaccines. That didn't help us any. These are vaccines that have been around for many years. They have been tried and tested and are successful and work. It's just that we have a society now that of parents that are very concerned about many of these things and trying to relieve that anxiety about the way vaccines have been done and all the bad information that came out with the COVID vaccines, talking about how they were produced or what they were done or how those things happened, has been really hard for us to keep kids immunized. And along with the fact that, you know, many places didn't immunize a lot of kids for a while because they were shut down, or you had to make an appointment, which was really hard for some of our families that maybe don't have access to online or didn't have a way to get to the clinics, and they obviously were not seeing as many kids because they had to make appointments and things. So there was a lot of problems trying to get these done, but a lot of it comes down to fear for the parent. I think sometimes also showing them those videos from that ADHS website about why the vaccines are important helps these people too. One of the county nurses always says, well, I don't know which one to give first because I don't know which disease are you willing to have your child have if we only give one today. And I always thought that was a good way to put it, is which disease do you think you want to take the risk of getting? Because if I don't give your kid these now, they run a risk of getting one of those diseases until we get them vaccinated.
That's a great point. There is a video that goes along with this. I will put it on the website because we are running short on time. I wanted to make sure that we talked about where you can find reliable resources to give to parents. So it's really important that you know which apps, websites, apps, books, videos are from trusted sources. We do have this handout available on our website that you can give to parents. It lists places like the American Academy of Pediatrics, CDC, Department of Health and Human Services. There are different apps and books and videos, all of that. The Children's Hospital of Philadelphia is a great resource for vaccine-related information. There's a lot of easy to understand videos talking about vaccines and common questions that you may receive. And then also we do recommend you go to the CDC website for any specific questions about vaccines. We have created a school nurse webpage just for you. So this was at the request of the Department of Education. We did a grant with them and they were saying, you know, we really wanted a one-stop shop place where nurses and health office staff can go to find lots of information. So we have on here this Padlet, and we heard that nurses love Padlets, where it's just kind of a way to organize the different resources that we have. So we have COVID-19 information. We have information about completing the IDR. What are the requirements? We have sample communication letters for parents. We also have the different immunization schedules that you can give to parents, and they can know which vaccines their child needs at which ages, and a lot more. We also have lots of handouts you can give directly to parents, like coloring sheets and fact sheets and, you know, all kinds of things like that. Makes it really fun for the kids. have this handout is also available on our website, and we will, Denise linked it in the chat. Thank you, Denise. So these are common questions that you may hear, and it's really easy to kind of read through. You can give this paper to parents. You can kind of prepare yourself, educate yourself a little bit more about how to have tough vaccine conversations with parents. It is available on our website. And of course, we recommend you check out our website, whyimmunize.org. We have a lot of free resources on our website. So lots of times nurses like to have some of these flyers to put up in their office. In the top right corner, we have this off to college one, which would be perfect in a high school nurse's office. It talks about the different vaccines you need before going to college. And then we have ones for younger kids. We get a lot of requests for this one kind of in the center, how to stop the spread of germs that make you and others sick. It's kind of like around flu season. Remember to cover your cough, wear a mask if you're sick and have symptoms, etc. So these resources are available on our website for free. You can just order them, we'll ship them to you. Some are flyer size or postcard sized or poster sized to put on your walls. So that's a great resource. And then my favorite thing to talk about is this program called Vaccines for Children. If a child's health insurance does not cover vaccines or they don't have health insurance, they can still get immunized against preventable diseases with no fee. It's a federally funded program called Vaccines for Children, and you can contact your local county health department for locations. I love this program. It is so useful to parents. Not having insurance or not having the ability to pay for vaccines should never be a barrier to children getting immunized. And that is it for today. So thank you so much to our presenters. We really appreciate your expertise and experiences. Thank you to all the questions that came in the chat. We think you're fantastic. We love to give prizes, and we've given away some prizes today, but you still have chances to win if you would like to fill out our survey. Denise is putting the link to the survey in the chat. We also have CEUs available for today. If you are a registered nurse, social worker, certified health education specialist, you can receive CEUs for today's training. Just a friendly reminder, you must have attended at least 90% of the training to receive those CEUs. So both of those links are in the chat. Thank you for joining us. Please reach out if you have any questions or if you need any help, any school nurse specific related information. We are here for you and willing to help you out.
Laura, I just wanted to say one thing real quick. Even though I'm with the National Cervical Cancer Coalition, if you have any males that need help, please refer them our way as well. And we know that both males and females should be getting HPV vaccine. So
thank you so much. That is great. And feel free to fill out those evaluations. Your input helps us improve future trainings. Tell us what you liked, what you didn't like, what we can do to improve for next time. So that is it. We ended right on time. If you have any last questions, if we didn't address it today, we can stick around for a minute if you want to put it in the chat. Otherwise, you guys are done. So thank you so much. All right, it looks like we don't have any questions. So have a great day, everyone.
Thank you.
Thank you. Bye-bye.